Hi, my name is Arthur. I own a French Bulldog. You can be either loved for it or judged for it, but there you go. I am a specialist in small animal surgery. My niche is providing services for brachycephalic dogs with airway disease. So, the Specialist Pug, Bulldog and Short-Nosed Dog Service. Let's not forget the short-nosed dog. So it might be a Boston or a Peak or anyone who wants to come along really. Brachycephalic obstructive airway syndrome, often referred to as BOAS, is a syndrome that leads to obstruction of the airways of short-nosed dogs with wide skulls. These dogs struggle to breathe, and as a consequence, they can struggle to exercise, sleep, eat. It's very hard to eat continuously if you have a blocked nose. You think about it when you have a cold yourself. Unfortunately, 60% of owners are unaware of their dog's disease process, even in those dogs in which it was life-threatening. One of the questions that we should ask is, does the dog need surgery? What's very unique is that we have the capacity to objectively assess the degree of upper airway obstruction using whole body barometric plethysmography. So we are the only centre in Australia that has the breathing box, if you want to call it that. So if there's a concern that whether or not the dog truly has upper airway obstruction, we can actually measure the extent of that. Quite unique and very limited availability in Australia, which is something that I do, is laser-assisted turbinectomy, particularly for the dog that struggles to sleep. Our service here provides a comprehensive and individualised assessment of each dog and then tailored intervention that is provided based on what each dog needs. So we do see patients who have had previous BOAS surgery, and there are dogs where their outcome is insufficient. If they don't have acceptable respiratory function, can we help them further? And the answer is typically yes. There are other procedures, and that really is my niche. That's what I love doing, is helping these super complicated dogs, the dogs who've already had surgery or the dogs who have very severe disease. To me, it's the people and the trust that people have put in me and the journey that we all go through together. So there's no single stand-up case really. There's a few too many now.